Yeah. So good morning, everyone. First, I want to take this chance to say thank you to all of you. We have been here for the last 7, 8 days now. They were really amazing. We learned so much from you. You are really grandmasters in microsurgery, and we are very honored to be here. So thank you very much for that. As you can see, my name is Raimund. I work. How does it work? Oh, perfect. Thank you. I work at the Medical University Graz at the Division of Plastic, Aesthetic and Reconstructive Surgery. The gentleman you can see here is the head of our department, Professor Kamholz, and also the head of the whole department of surgery. Just to give you a quick overview, we have 32 inpatient beds, 2 intensive care beds, 6 burn victim beds. We are 16 specialists in our department and 10 residents. We are a certified training center from EvoPras. This means that our residents can do the whole rotation in our university hospital. We are also a certified center for hand trauma and replantation and a certified burn center, as well as a certified breast cancer center. Can you do the next slide, please? Okay. So this is our university hospital, and we're just a very small part of it, as you can see. 2024, we had 1,948 inpatients. So I'm quite sure that is not a lot for you, but you just have to think about whole Austria is smaller than Seoul. So yeah, we had 643 day clinic patients, and we have on average 12 to 15,000 outpatients per year. Also, our employees go to 5 different hospitals in our state to help there when they need a plastic surgeon. We have a quite wide spectrum. Actually, we do reconstructive microsurgery, hand surgery, burn, nerve, plexus surgery, body contouring procedures and aesthetic surgery, also congenital malformations and transgender surgery. We don't do clefts, we don't do craniosynostosis, we don't do bony reconstruction in head and neck, but the soft tissue reconstruction. And we just started to do LVAs in just a few cases. Okay, so now about my education. I graduated in 2012, made my Ph.D. in 2022 in molecular medicine and inflammation. The topic of my thesis was about the injection of platelet-rich plasma and autologous fat into the thumb metacarpal joint. We also, next slide please, we also okay, no problem. Okay, so can you go one back? Yes, okay. So we also published it in PRS, and we were very lucky, and we got the Best Paper Award 2024. Yes, and so 2023, I obtained my venia docendi in plastic surgery, which is something like associate professor or something like that. Okay, so it's just in Austria and in Germany. Okay, work experience, just briefly, my basic training was in internal medicine, trauma surgery, general surgery, and anatomy. And then I was a resident from 2015 to 2019, then became consultant, 2021 senior consultant in charge of the ward, and 2023 I opened a private practice, and 2025 I finished my subspecialization in hand surgery. Next slide, please. Okay, that's just the work experience. Everybody of you probably does like the review things and author things and editorial board and book chapters and these things. Okay, next slide, please. And last but not least, this is my family, and my older son has birthday today, actually. So he is getting 9 years. So next, happy birthday, Leopold. Okay. So thank you very much for everything.
Does it work? Great. So now it's my turn to introduce myself. I'm Patrick, as you know by now, and I'm a consultant also at the Medical University of Graz. I will keep it shorter than Raimund because you already know our hospital. I did my med school at the Medical University of Graz and graduated in 2015 with my diploma thesis concerning unidentified mammocarcinoma in breast reduction surgery. And after that, I obtained my Ph.D. degree in 2020 at the Paracelsus Medical University in Salzburg with my work on peripheral nerve surgery. As also Raimund, since then I have been assigned as a reviewer for multiple peer-reviewed journals, such as the European Burn Journal, JPM, the PRS Global Open, Neurology and Neurosurgery, just to name a few of them. After med school, I started my basic training in 2016 at the military hospital and did there mostly dermatology and surgery, and continued my basic training at the St. John of God Hospital in Salzburg, where I did plastic surgery, general surgery, gynecology, and internal medicine. After that basic training, I started my residency as a general surgeon at the University Hospital in Salzburg, and quickly changed to my real passion, which was plastic surgery back then, and was a resident for plastic surgery from 2018 till 2020. And due to the COVID pandemic, I decided to complete my training on home soil in Austria and completed my residency training at the Medical University of Innsbruck. And then finally, after completion of my residency, I came back to my alma mater, and since then I work as a consultant plastic surgeon at the Medical University of Graz and have a special interest in reconstructive microsurgery, and therefore I'm here and try to learn new things from you. A little bit to my microsurgical interest. This year we first introduced the robotic scope, which is an exoscope fitted on a robotic arm into the clinical practice. And we also did the first robotic supported LVA in Austria with this robotic scope. And this year also I have the honor to be the course coordinator for the first joint free flap course of the Medical University of Graz, together with the Penn State University, which is especially designed for Ukrainian surgeons to teach them free flap surgery and to help them in one way or another. So that's my brief introduction, Asamida, and we once again like to thank you for having us, for welcoming us so warm, and we're really thankful to learn a lot of things from you. And of course, you're very, very welcome to Austria to visit whenever you want. Thank you.
How many consultants are there in there?
We are 16 consultants.
16.
Yeah, 16 consultants and 10 residents.
Which robotic machine did you use for the LVA?
We used the robotic scope. That's why I didn't say robotic assisted, but robotic supported, because the microscope was on a robot arm, and it might be distinguishable on the picture I showed you. We wore like VR helmets, which had the
Exoscope.
yeah. No, it's the wrong one.
I'll change it here.
Yeah, and this is the microscope, which has a camera fitted at a. Actually, the robot is from the automobile industry, and with these helmets, you can guide the microscope, so you don't have to let your hands go from the microscope in any way. And with the head gestures, you can control the whole microscope, zoom in, zoom out.
You can also turn the angle
Yeah, which is
Yeah, yeah,
particularly
which is really
helpful.
nice. Yes,
without
yes, the
moving your
moving
head.
The only thing, that's just
Yeah.
my opinion,
Yeah.
which is not like so nice, is that the picture is not as sharp as it is on the normal microscope. But it's a very nice tool, a very nice tool.
Okay, thank you so much.
Thank you.